A survey of 50,000 heterosexual men found 55% were unhappy with their penis appearance. But here's what might shock you. When their partners were asked, 85% of women reported being completely satisfied. This disconnect reveals something crucial about male perception versus reality. The average erect length used in studies is about 5.2 inches. Clinically, a penis is classified as a micropenis if it is shorter than about 2.9 inches, a very rare condition, affecting only 0.14% of men. Most men fall within the normal variation around that 5.2-inch average. Many men consider risky procedures for size concerns, but for most, the problem is perception, not anatomy. In this video, I'll show what actually works, what doesn't, and the safest first step. If you want clear, evidence-based answers, hit subscribe. I break this stuff down without hype. But first, we need to understand why so many men with completely normal anatomy believe they have a problem that requires dangerous solutions. The condition driving this distress has a name: small penis anxiety, a legitimate form of body dysmorphic disorder that affects men with completely normal anatomy. This isn't casual worry or occasional self-doubt. When it develops into full disorder, men spend over an hour daily obsessing about their penis size, avoiding intimate relationships, refusing to use public restrooms, and declining activities that require changing clothes around others. In severe cases, the distress can lead to hospitalization or even suicidal ideation. Pornography and media have fundamentally distorted what men consider normal, creating unrealistic standards where average anatomy appears deficient by comparison. The numbers reveal the scope of this hidden epidemic. Most men who visit doctors seeking penis enlargement procedures fall within the medically normal range. They're not suffering from any physical abnormality, yet they experience genuine distress about their size. Studies use a mean stretched or erect length of about 5.2 inches and consider values within roughly 2.5 standard deviations of that mean to be normal. Clinically, doctors only treat true shortness when it meets the micropenis threshold, less than 2.9 inches, which affects about 0.14% of men, roughly 1 in every 700. The progression from mild concern to debilitating anxiety follows a predictable pattern. It starts with occasional negative thoughts about size, escalates to frequent comparison with others, and eventually dominates thinking patterns. Men report checking their penis size multiple times daily, measuring obsessively, and researching enlargement methods for hours online. They avoid medical checkups that require genital examination and withdraw from relationships entirely. The harsh reality is that most men's distress stems from warped perception, not actual anatomical problems. Their penises are normal by every medical standard, yet their minds have convinced them otherwise. So if most men are anatomically normal but distressed, what happens when they pursue the enlargement methods flooding the market? The enlargement industry generates millions in revenue each year, but professional medical guidelines classify most penile enlargement procedures as experimental. This classification reflects decades of clinical evidence showing these methods consistently fail to deliver safe, satisfactory results. Surgical options carry particularly high complication rates with poor patient satisfaction scores. Cutting the suspensory ligament can make the flaccid penis hang lower, but may cause instability or changes in how the penis points during erection. Grafts, fat transfer, silicone implants, and other reconstructive attempts often produce poor cosmetic results, uneven contours, loss of sensation, and in extreme cases, infection or disfigurement. Some men develop permanent curvature or scarring that makes normal sexual function impossible. Implant procedures carry the highest risk of devastating complications. Foreign materials placed under penile skin can shift, extrude through the surface, or cause severe infections. Revision surgeries to correct these problems often make the situation worse, leading to permanent disfigurement. Clinical studies do not show permanent length increases from vacuum erection devices. These devices can temporarily increase blood flow and create the appearance of size enhancement, but no permanent changes occur. Despite marketing claims about enlargement, no measurable length increase occurs with their use. Penile injections represent perhaps the most dangerous non-surgical option. Men inject substances like silicone, paraffin, or various oils directly into penile tissue. These injections frequently cause permanent lumps, granulomas, and tissue death. The injected materials can migrate to other body parts, create chronic pain, and require extensive reconstructive surgery to address complications. Major professional guidance, for example, the Sexual Medicine Society of North America, classifies most lengthening or girth-enhancing procedures as experimental and does not recommend them outside of true micropenis cases or controlled clinical trials. Clinical trials have institutional review boards, adverse event monitoring, and publication requirements, which is why experimental procedures should be restricted to trials with proper oversight. The medical establishment's extreme caution stems from overwhelming evidence that enlargement procedures don't work safely. However, within this landscape of failed methods and dangerous procedures, one approach does show measurable results in clinical studies. Penile traction devices represent the sole non-surgical method with legitimate scientific backing. These mechanical devices apply gentle, continuous stretching force to penile tissue over extended periods, and they're the only enlargement approach that consistently shows measurable results in clinical studies. The realistic gains possible through traction therapy are modest but measurable. Studies report modest gains, about 2 centimeters, but only after months of daily use. Published trials commonly require multiple hours per day, with clinical reports often citing around 4 to 6 hours daily for several months. This represents roughly 3/4 of an inch, a meaningful but limited improvement. The key word here is consistent. Men who use traction devices sporadically or for short periods see minimal to no results. The commitment required for any measurable effect is extensive and demanding. Users must wear the device for multiple hours daily over a period of 3 to 6 months minimum. This means integrating the device into work schedules, sleep patterns, and daily routines. The treatment requires the same dedication as physical therapy rehabilitation. Missing days significantly reduces effectiveness. The device applies sustained, gentle tension, prompting gradual tissue remodeling and lengthening over time. The body responds to sustained stretching by gradually lengthening the affected structures through this natural adaptation process. The downsides: the time commitment is large. Devices can cause numbness, bruising, or skin irritation, and some users see little or no benefit even after months. The devices themselves cost several $100s and require proper fitting to avoid injury. Poor adherence to usage guidelines can result in no measurable gains despite months of effort and expense. If you're considering traction, discuss it with a urologist first and plan realistic expectations. Small, slow gains, not a dramatic change. These modest gains pale in comparison to the exaggerated claims of surgical procedures or injection treatments. A 2-centimeter gain may not address the underlying psychological distress that drives men to seek enlargement in the first place. While traction devices offer the only scientifically proven path to modest length increase, they require realistic expectations and significant commitment. For most men struggling with size concerns, the real solution may lie in an entirely different direction. Psychological counseling represents the primary recommended treatment for size-related anxiety, with success rates that far exceed any physical enlargement method. Mental health professionals who specialize in body image disorders report remarkable outcomes when treating men with penis size concerns. Studies and clinical reports show that a large majority of men who undergo validated psychological assessment and counseling stop seeking physical enlargement treatments. They no longer seek surgical procedures, stop researching enlargement devices, and abandon plans for risky interventions. This dramatic shift occurs because therapy addresses the actual source of distress rather than attempting to modify normal anatomy. The condition driving this distress, small penis anxiety, can develop into a form of body dysmorphic disorder where men spend over an hour daily obsessing about size and suffer significant functional impairment. This isn't casual worry, but a recognized psychological condition that affects relationships, work performance, and daily activities. Understanding this helps explain why counseling represents genuine medical treatment, not simple reassurance. Validated psychological assessments help men understand normal anatomical variation through objective measurement and comparison data. Therapists present comprehensive medical literature showing the wide range of normal penis sizes. Men learn that their perceived inadequacy stems from distorted comparison standards, not actual physical deficiency. Cognitive behavioral techniques help men identify and challenge negative thought patterns about their bodies, while interrupting obsessive measuring behaviors. Therapy addresses the underlying anxiety and distorted perceptions that drive size-related distress. Men learn practical strategies for managing anxiety when these thoughts arise, and develop healthier perspectives about sexual performance and partner satisfaction. Group therapy sessions allow men to hear similar experiences from others, reducing feelings of isolation and abnormality. Additional practical strategies can enhance psychological work and provide immediate confidence improvements. Manscaping or trimming pubic hair can make the penis appear larger, while losing weight often reduces suprapubic fat that hides length. Both represent safe, immediate steps that improve appearance and boost confidence alongside therapy. The safety and effectiveness of psychological treatment contrast sharply with risky physical interventions. Therapy carries no risk of surgical complications, permanent disfigurement, or loss of sexual function. If size-related thoughts cause real distress, consult a qualified mental health professional experienced in body image disorders and a reputable urologist. Avoid unlicensed providers and do not self-inject substances. This approach addresses the fundamental issue underlying most men's concerns. The research reveals 3 clear takeaways about penis size concerns. First, most size concerns are perception. Get an objective assessment from a qualified professional. Second, therapy is the evidence-based first step and often eliminates the desire for risky procedures entirely. Third, traction devices can give modest gains, but require months of multi-hour daily use, while surgery and injections carry significant, sometimes devastating risks, and are considered experimental by medical professionals. Understanding normal variation and addressing anxiety leads to greater confidence and satisfaction than any physical modification could provide. Your mind holds the key to resolving this distress safely and effectively. If this surprised you, drop a comment below. Did you know these facts about size and treatment? If you're worried, reach out. These issues are common and help is available.